Have you ever noticed an unusual smell on your breath, skin, or even in your sweat and just brushed it off as nothing? What if I told you that your body might be trying to tell you something important? It may sound surprising, but research shows that certain types of cancer can produce distinct odors, subtle but critical clues that many people overlook. Your body is an amazing machine, always working hard to keep you healthy. However, when something goes wrong, like the development of cancer, it can mess with your metabolism, triggering chemical changes that affect how you smell. These aren't just random smells, they're caused by volatile organic compounds, VOCs, released by cancer cells. In this video, we'll explore 8 distinct cancer-related smells that could serve as early warning signs, because when it comes to cancer, early detection can be life-saving. Decomposing odor in stool, a hidden clue to colorectal cancer. Let's face it, no one enjoys talking about bathroom habits, but paying attention to changes in your stool could actually save your life. One of the most overlooked signs of colorectal cancer is a persistent, strong decomposing odor in stool, something much worse than usual. This smell is often described as rotting or decaying, and it lingers even after dietary changes. Why does this happen? As a tumor grows in the colon or rectum, it disrupts the normal digestive process. This can lead to incomplete breakdown of food, toxin buildup, and changes in gut bacteria. The body struggles to process nutrients properly, resulting in the release of toxic gases and foul-smelling compounds. The stool becomes much stronger smelling, often resembling decomposing food. Aside from the unusual odor, other warning signs to look for include blood in the stool, which can appear bright red, dark, or even black and tar-like. Persistent abdominal pain, cramping, or bloating could signal an obstruction in your intestines. Sudden weight loss or changes in bowel habits, such as long-term constipation or diarrhea, should also raise red flags. If you've noticed a consistent change in the smell of your stool, or if you're experiencing any of these symptoms, it's important to get checked by a doctor. A colonoscopy or stool analysis can detect abnormalities in the colon before cancer has a chance to spread. The good news is that colorectal cancer is highly treatable when caught early. So, don't ignore what your body is telling you. If something smells off, take action. Sweet, unpleasant skin odor, a hidden clue to breast cancer. A sweet, foul odor from the breast area can signal advanced breast cancer. This odor is caused by tissue decay, infections, or ulcers releasing volatile organic compounds, VOCs. Often mistaken for poor hygiene, it's important not to ignore this symptom. Other signs to watch for include lumps in the breast or armpit, skin texture changes like dimpling or redness, nipple discharge, and persistent breast pain. If you notice any of these, seek a doctor for early detection with a mammogram, ultrasound, or biopsy. Early detection is key. Moldy or rotten wood breath, a hidden warning of mouth and throat cancer. Have you ever talked to someone and noticed a strange, musty, or moldy smell on their breath? Or maybe you've experienced it yourself and brushed it off as something you ate or bad oral hygiene. But what if I told you that persistent moldy or rotten wood-like breath could actually be an early sign of mouth or throat cancer? This happens because cancerous tumors in the mouth or throat can disrupt normal tissue, causing decay, infections, and the release of volatile organic compounds, VOCs. These VOCs give off a unique odor, often compared to mold, rotting wood, or something musty. Many people dismiss this as just bad breath from food, smoking, or poor dental care. But when the smell lingers despite proper oral hygiene, it could be a warning sign that something deeper is going on. In addition to unusual breath odor, other symptoms to watch out for include persistent hoarseness, difficulty swallowing, feeling like food is stuck in your throat, mouth sores that won't heal, and red or white patches inside the mouth. Some people may even experience unexplained ear pain, which can be referred pain from the throat. If these symptoms persist for more than 2 weeks, it's time to visit a doctor. A biopsy, MRI, or CT scan can help detect mouth or throat cancer early, when it's most treatable. Don't ignore persistent changes in breath odor or any unusual symptoms. Early detection is key in the fight against cancer. Sulfur or rotten egg breath, a hidden clue to stomach cancer. Persistent sulfur or rotten egg breath, despite brushing or using mouthwash, could indicate stomach cancer. This odor is caused by an overgrowth of bacteria producing hydrogen sulfide gas. Other symptoms include nausea, bloating, loss of appetite, indigestion, and blood and stool. If you experience sulfuric breath along with digestive issues, consult a doctor for a gastroscopy or imaging tests like CT scans. Early detection is crucial for successful treatment. Don't ignore persistent changes in breath. Rotten meat smell, a warning sign of advanced skin cancer. Have you ever noticed a foul, rotting meat-like odor coming from a skin lesion or wound? While most people associate skin cancer with changes in moles or new growths, many don't realize that a persistent bad smell can also be a red flag, especially in more advanced cases of skin cancer. As skin cancer progresses, particularly melanoma or aggressive non-melanoma types, cancer cells begin to multiply uncontrollably, damaging healthy tissue. Over time, tumors can outgrow their blood supply, leading to necrosis, tissue death. When skin cells die, they release volatile organic compounds, VOCs, causing a strong, putrid odor that's similar to decaying flesh. Additionally, ulcerated tumors can become infected, making the smell even worse. Many people mistake this for a minor skin infection or poor hygiene, which can delay critical medical attention. Along with the distinct rotten odor, there are other important warning signs of skin cancer. A mole or dark spot that changes in size, shape, or color should always be checked by a dermatologist. Sores or ulcers that won't heal, even after several weeks, are also concerning. If a skin lesion becomes itchy, starts to bleed, crusts over, or oozes, it's time to seek medical advice. If you notice a suspicious spot, lesion, or wound with a foul odor, don't wait. A dermatologist can perform a skin biopsy to determine if it's cancerous. Melanoma, one of the deadliest skin cancers, has a much higher survival rate when caught early, so don't hesitate to get checked out. Ammonia-smelling urine, a silent warning of kidney cancer. If you notice a strong, persistent ammonia-like odor in your urine, it could be more than dehydration or diet changes. This may signal kidney cancer, a disease that often shows no symptoms until it's advanced. When kidney function is impaired by cancer, waste byproducts build up in the body, leading to ammonia-smelling urine. It may persist even with proper hydration. Other key signs to watch for include blood in the urine, pink, red, or brown, persistent lower back pain near the kidneys, fatigue, and unexplained weight loss. If you notice ammonia-smelling urine along with these symptoms, see a doctor for early detection with ultrasound, MRI, and urine tests. Early diagnosis improves treatment success. Metallic smell in breath and sweat, a hidden clue to blood cancer. A strange metallic or rusty smell in your breath or sweat could indicate blood cancer, like leukemia or lymphoma. Blood cancers disrupt blood cell production, releasing volatile organic compounds, VOCs, that create a metallic odor. This smell is noticeable in breath, sweat, and skin, often after light activity. Other symptoms include extreme fatigue, frequent infections, unexplained bruising, persistent fever, night sweats, and unexplained weight loss. If you notice a metallic smell along with these signs, seek medical attention. A blood test and bone marrow biopsy can help detect blood cancer early, improving treatment outcomes. Sweet, fruity breath, a hidden warning sign of lung cancer. A persistent sweet, fruity odor on the breath, not caused by diet or diabetes, could signal lung cancer. This smell arises from metabolic changes caused by the cancer, which release volatile organic compounds, VOCs, exhaled in the breath. Lung cancer often presents with other signs like a chronic cough, wheezing, shortness of breath, hoarseness, chest pain, unexplained weight loss, and fatigue. If you or someone you know has fruity breath along with these symptoms, consult a doctor. Early detection through chest X-rays, CT scans, and lung function tests can improve treatment success.